I'm going to talk briefly about neck surgery or neck lift surgery. Now, I think it's true to say that whenever you have surgery on the face, that is facelift surgery, generally speaking, you do get a neck lift. In other words, let's think about jowling. So you have jowling. If we lift the jowls up, as you can see how the neck moves up. So that is to say that every time we work on the face, we tend to lift the neck. However, if you have a lot of excess skin in the neck, just by lifting the face and making cuts around the ear and lifting the skin up, it doesn't get rid of that excess skin and excess fat in the neck. So neck lift surgery in specific deals with the fat that sits under the skin. Now, here's the important thing. There is a muscle called the platysma that sits under the skin and it's almost attached to the skin. And the fat that forms in the neck can be in front of the platysma, which means it's between the skin and the platysma, what we call the pre-platysmal fat, or you can get fat that sits behind the platysma. So, if the fat that sits behind the platysma is not removed during surgery, you will notice that even after you've had a surgical procedure on the neck, often the neck will look quite heavy and bulky. And it's also not to say that we can remove all the fat from the neck. There are certain limits to which one can go. So, to keep it very simple with neck lift surgery, the idea is to reduce the skin and to reduce the fat and all. How do we do it? We make a tiny cut under the chin, which forms, which is just under the skin crease, and then we lift the skin up, we access the fat, we remove the fat, and then we tighten the muscle that is called the platysma by putting some stitches. That's what we call the platysmoplasty. So once we do that, we often make a cut around the ears so that we can redrape your skin. So we have basically dealt with it from the front and from around the ears. And very occasionally, in some people, we may have to cut down here to bring the skin together. But that is not in everyone. So overall, if you have a problem with the neck lift surgery works very well, but it is as invasive as, I would say, facelift surgery, but done properly, obviously you get excellent results.